Question 1. A COPD client on 2 liter per minute nasal cannula becomes drowsy. ABG shows pH 7.31, PaO 262, PaO 270. What is the nurse's best action? A. Increase oxygen to 6 liters per minute. B. Prepare for non-invasive ventilation. C. Administer prescribed opioid for anxiety. D. Encourage pursed lip breathing only. Answer. B. Prepare for non-invasive ventilation. Rationale. Rising CO2 with acidosis shows ventilatory failure. NIV supports ventilation without suppressing drive. High oxygen may worsen CO2 retention. Opioids depress respirations. Breathing techniques alone are insufficient. Question 2. Which assessment most reliably indicates early tension pneumothorax after central line insertion? A. Tracheal deviation. B. Sudden anxiety with tachycardia. C. Absent bowel sounds. D. Mild incisional pain. Answer. B. Sudden anxiety with tachycardia. Rationale. Early signs are subtle. Anxiety and tachycardia from hypoxia occur before late sign of tracheal shift. GI and pain findings are unrelated. Question 3. The nurse must delegate care. Which task is safest to assign to the LPN? A. Initial assessment of new hemoptysis. B. Teaching incentive spirometer use. C. Monitoring stable chest tube drainage. D. Evaluating readiness for extubation. Answer. C. Monitoring stable chest tube drainage. Rationale. LPN may monitor stable conditions. Initial assessments, teaching, and evaluation require RN clinical judgment. Question 4. A client with ARDS has PaO 258 on FiO 290%. Which action reflects correct prioritization? A. Increase FiO2 to 100% only. B. Request PEEP adjustment. C. Administer IV fluids rapidly. D. Reduce sedation immediately. Answer. B. Request PEEP adjustment. Rationale. Refractory hypoxemia requires alveolar recruitment with PEEP. Simply raising FiO2 risks oxygen toxicity. Fluids may worsen edema. Abrupt sedation change causes dysynchrony. Question 5. Select all that apply. Which findings require immediate action in a client with pulmonary embolism on heparin? A. Platelets drop from 210,000 to 96,000. B. APTT 1.5 times control. C. New onset flank pain. D. Sudden headache and confusion. Answer. A. Platelets drop from 210,000 to 96,000. C. New onset flank pain. D. Sudden headache and confusion. Rationale. Platelet fall suggests HIT. Flank pain may indicate retroperitoneal bleed. Neuro changes suggest intracranial bleed. APTT 1.5 times is therapeutic. Question 6. True or false? For a client with chest tube, clamping is the first step when accidental disconnection occurs? A. False. B. True. Answer. A. False. Rationale. The tube should be placed in sterile water to create a seal. Clamping can cause tension pneumothorax. Question 7. Which statement best demonstrates ethical clinical judgment for a ventilated client without advanced directives? A. Follow family request to extubate immediately. B. Continue treatment until surrogate identified. C. Ask another nurse to decide. D. Stop all sedation to obtain consent. Answer. B. Continue treatment until surrogate identified. Rationale. Care continues under beneficence, while legal decision-maker is determined. Others violate ethical/legal standards. Question 8. A post-lobectomy client has sudden 200 milliliters bright red chest tube output in 30 minutes. Priority action? A. Milk the chest tube. B. Notify surgeon immediately. C. Document and recheck in 1 hour. D. Increase suction level. Answer. B. Notify surgeon immediately. Rationale. Greater than 100 milliliters per hour bright blood suggests hemorrhage. Milking and higher suction are unsafe. Delay risk shock. Question 9. Yes or no? Should a nurse administer albuterol before scheduled tiotropium? A. Yes. B. No. Answer. A. Yes. Rationale. Short-acting bronchodilator first opens airways, improving delivery of long-acting anticholinergic. Question 10. Which client is safest to transfer from ICU to medical unit? A. BiPAP RR28, pH 7.33. B. Chest tube with intermittent leak. C. Tracheostomy with copious secretions. D. Pneumonia on 3 by nasal cannula, SpO2 95%. Answer: D. Pneumonia on 3 by nasal cannula, SpO2 95%. Rationale: stable oxygenation with minimal support is appropriate. Others require advanced airway management. Question 11. A client with asthma received 3 albuterol nebulizers and now reports palpitations and tremors. What is the nurse's priority action? A. Hold further doses and assess apical pulse. B. Administer prescribed beta blocker. C. Encourage the client to rest only. D. Increase oxygen to 6 liters per minute. Answer: A. Hold further doses and assess apical pulse. Rationale: beta agonists commonly cause tachycardia and tremors. The nurse must first assess for toxicity and withhold additional doses. Beta blockers are contraindicated in asthma. Rest and higher oxygen do not address the medication effect. Question 12. Which finding best indicates that a client with pneumonia is responding to therapy? A. WBC count decreased from 18,000 to 11,000. B. Cough becomes more productive. C. Chest X-ray unchanged after 24 hours. D. Temperature 37.9 degrees Celsius, 100.2 degrees Fahrenheit. Answer: A. WBC count decreased from 18,000 to 11,000. Rationale: falling leukocytosis is an early objective sign of improvement. Productive cough may persist, X-ray lags behind clinical status, and low-grade fever may continue. Question 13. The nurse caring for a client with a tracheostomy notes high pressure alarm on the ventilator. Which action comes first? A. Suction the airway. B. Call respiratory therapy. C. Increase oxygen percentage. D. Silence the alarm. Answer: A. Suction the airway. Rationale: high-pressure alarms often indicate obstruction from secretions. Suctioning is the immediate intervention. Others delay correction of the cause. Question 14. Select all that apply. Which actions reduce the risk of oxygen-induced hypoventilation in COPD? A. Titrate oxygen to target SpO2 88 to 92%. B. Use Venturi mask for precise delivery. C. Administer 100% oxygen during sleep. D. Monitor mental status and ABGs. Answer: A. Titrate oxygen to target SpO2 88 to 92%. B. Use Venturi mask for precise delivery. D. Monitor mental status and ABGs. Rationale: controlled oxygen and close monitoring prevent CO2 narcosis. Routine 100% oxygen is unsafe in CO2 retainers. Question 15. True or false? Diminished breath sounds immediately after thoracentesis are always an expected finding? A. False. B. True. Answer: A. False. Rationale: this may indicate pneumothorax or reaccumulation of fluid and requires prompt evaluation, not assumption of normality. Question 16. A client with cystic fibrosis asks about preventing infections at home. Which response shows best clinical judgment? A. Avoid all physical exercise. B. Perform airway clearance daily. C. Take antibiotics only when febrile. D. Limit fluid intake. Answer: B. Perform airway clearance daily. Rationale: routine airway clearance mobilizes secretions and decreases infection risk. Exercise and fluids are encouraged. Antibiotics are taken as prescribed, not only with fever. Question 17. After intubation, the nurse hears gurgling over the epigastrium and no breath sounds on the left. What action is priority? A. Remove the tube and ventilate with bag mask. B. Obtain chest X-ray to confirm placement. C. Secure the tube more tightly. D. Increase ventilator rate. Answer: A. Remove the tube and ventilate with bag mask. Rationale: findings indicate esophageal intubation, an emergency requiring immediate removal and reventilation before confirmation imaging. Question 18. Yes or no? Should incentive spirometry be withheld in a postoperative client reporting pain at the incision site? A. No. B. Yes. Answer: A. No. Rationale: spirometry prevents atelectasis. Pain should be treated so the client can continue, not used as a reason to withhold therapy. Question 19. Which arterial blood gas result in a COPD client requires most urgent intervention? A. pH 7.36, PaCO 255, PaO 268. B. pH 7.28, PaCO 270, PaO 260. C. pH 7.38, PaCO 250, PaO 272. D. pH 7.35, PaCO 258, PaO 266. Answer: B. pH 7.28, PaCO 270, PaO 260. Rationale: this shows acute on chronic respiratory acidosis with severe hypercapnia and hypoxemia requiring ventilatory support. Others reflect compensated or baseline values. Question 20. The nurse is evaluating education for a client prescribed home oxygen. Which statement indicates a need for further teaching? A. I will avoid using petroleum jelly in my nose. B. I can cook on a gas stove while using oxygen. C. I will keep oxygen away from open flames. D. I should not smoke while oxygen is on. Answer: B. I can cook on a gas stove while using oxygen. Rationale: gas stoves are ignition sources and unsafe with oxygen. Other statements reflect correct safety principles. Question 21. A client with pulmonary fibrosis reports increasing dyspnea while on 4 liter per minute oxygen. SpO2 is 86%. What is the nurse's best next action? A. Place the client in high Fowler position. B. Increase oxygen to 10 liter per minute by nasal cannula. C. Encourage the client to ambulate. D. Administer a sedative for anxiety. Answer: A. Place the client in high Fowler position. Rationale: positioning improves ventilation immediately. Large oxygen increases by nasal cannula are ineffective. Ambulation and sedation may worsen hypoxia. Question 22. Which laboratory result is most concerning in a client receiving long-term prednisone for severe asthma? A. Potassium 3.0 milliequivalent per liter. B. Glucose 210 milligrams per deciliter. C. WBC 13,000 per cubic millimeter. D. Sodium 138 milliequivalent per liter. Answer: A. Potassium 3.0 milliequivalent per liter. Rationale: corticosteroids cause potassium loss leading to dysrhythmias and muscle weakness affecting respiration. Hyperglycemia and mild leukocytosis are expected effects. Question 23. The nurse hears a continuous low-pitched snoring sound in a sedated client after bronchoscopy. Which action is priority? A. Perform jaw thrust and open airway. B. Provide oral fluids. C. Document as normal finding. D. Administer antitussive. Answer: A. Perform jaw thrust and open airway. Rationale: snoring indicates partial airway obstruction from tongue relaxation. Airway maneuvers are first before other actions. Question 24. Select all that apply. Which assessment findings suggest COR pulmonale in a client with chronic lung disease? A. Peripheral edema. B. Jugular venous distension. C. Loud P2 heart sound. D. Clubbing of fingers. Answer: A. Peripheral edema. B. Jugular venous distension. C. Loud P2 heart sound. Rationale: these reflect right-sided heart failure from pulmonary hypertension. Clubbing relates to chronic hypoxia, not specifically COR pulmonale. Question 25. True or false? A negative D-dimer reliably rules out pulmonary embolism in a high-risk hospitalized client? A. False. B. True. Answer: A. False. Rationale: D-dimer is useful only in low-risk clients. Hospitalized high-risk patients require imaging regardless of result. Question 26. Which action demonstrates correct infection control for a client with suspected tuberculosis? A. Place in negative pressure room. B. Use surgical mask for the client only. C. Allow visitors without protection. D. Use standard precautions only. Answer. A. Place in negative pressure room. Rationale. TB requires airborne isolation with negative pressure and N95 respirators. Surgical mask alone and standard precautions are inadequate. Question 27. After suctioning a tracheostomy, the client develops sudden bradycardia. What should the nurse do first? A. Stop suctioning and oxygenate. B. Continue suctioning to clear airway. C. Administer atropine. D. Lower the head of bed. Answer. A. Stop suctioning and oxygenate. Rationale. Bradycardia is caused by vagal stimulation and hypoxia. Immediate oxygenation is required before medications. Question 28. Yes or no? Should the nurse instill normal saline before routine endotracheal suctioning to loosen secretions? A. No. B. Yes. Answer. A. No. Rationale. Saline instillation increases infection risk and hypoxia and is not recommended for routine suctioning. Question 29. Which client statement after teaching about fluticasone inhaler indicates correct understanding? A. I will rinse my mouth after each use. B. I will use it only during attacks. C. This medicine works immediately. D. I should avoid using a spacer. Answer. A. I will rinse my mouth after each use. Rationale. Rinsing prevents oral candidiasis. Fluticasone is a controller, not rescue. Onset is not immediate. Spacers are encouraged. Question 30. A client on mechanical ventilation has sudden high peak pressures and decreased tidal volumes. Which problem should the nurse suspect first? A. Kinked endotracheal tube. B. Ventilator power failure. C. Hypokalemia. D. Sedation overdose. Answer. A kinked endotracheal tube. Rationale. Acute rise in pressures with low volumes usually indicates obstruction or kink. This must be assessed before metabolic or medication causes. Question 31. The displayed ventilator pressure time waveform is best interpreted as which condition? A. Normal ventilation pattern. B. Auto PEEP. C. Circuit leak. D. Bronchospasm. Answer. A. Normal ventilation pattern. Rationale. The waveform returns to baseline with smooth inspiratory and expiratory phases, indicating normal resistance and compliance. Other options show distortion or failure to return to zero. Question 32. This expiratory flow pattern most strongly suggests what problem? A. Airway obstruction from secretions. B. Excessive tidal volume. C. Sedation overdose. D. Ventilator disconnection. Answer. A. Airway obstruction from secretions. Rationale. Scooped or concave expiratory curve reflects increased airway resistance typical of mucus or bronchospasm. Disconnection would show absent waveform. Question 33. The waveform fails to return to baseline before next breath. What is the priority action? A. Increase PEEP setting. B. Allow longer expiratory time. C. Give neuromuscular blocker. D. Increase respiratory rate. Answer. B. Allow longer expiratory time. Rationale. Failure to reach baseline indicates auto PEEP. Reducing rate or increasing expiratory time prevents air trapping. Increasing rate worsens it. Question 34. Low peak pressures with preserved shape indicate which issue? A. Circuit or cuff leak. B. Decreased lung compliance. C. Kink tubing. D. Pulmonary edema. Answer. A circuit or cuff leak. Rationale. Leaks cause globally low pressures without obstruction pattern. Kinks raise pressures. Edema decreases compliance with higher peaks. Question 35. Sudden sharp pressure spikes during inspiration are most consistent with what? A. Patient biting endotracheal tube. B. Need for suctioning only. C. Ventilator malfunction. D. Adequate synchrony. Answer. A. Patient biting endotracheal tube. Rationale. Intermittent spikes from external compression occur with biting. Suctioning gives gradual changes, not abrupt peaks. Question 36. A progressive rise in peak pressure during the breath suggests which priority problem? A. Mucus plug formation. B. Excess oxygen flow. C. Anxiety. D. Hypovolemia. Answer. A. Mucus plug formation. Rationale. Sudden increased resistance within the airway raises pressures and requires suctioning and assessment. Question 37. 2 breaths delivered for 1 patient effort indicates what phenomenon? A. Double triggering. B. Apnea. C. Auto PEEP. D. Normal assist mode. Answer. A. Double triggering. Rationale. Patient demand exceeds set flow or volume causing 2 stacked breaths. Risks volatrauma and needs setting adjustment. Question 38. Prolonged, slow expiratory limb is most consistent with which condition? A. Bronchospasm or COPD. B. Pulmonary fibrosis. C. Large circuit leak. D. Hyperventilation. Answer. A. Bronchospasm or COPD. Rationale. Obstructive disease delays exhalation. Fibrosis would show stiff lungs with high pressures but not prolonged flow. Question 39. Reduced amplitude with higher pressures indicates what change? A. Decreased lung compliance. B. Improved compliance. C. Accidental extubation. D. Water intubing. Answer. A. Decreased lung compliance. Rationale. Stiffer lungs require more pressure for same volume as seen in ARDS or edema. Extubation would show loss of waveform. Question 40. The inspiratory flow rises slowly and patient appears air hungry. What is the best intervention? A. Increase inspiratory flow rate. B. Increase PP. C. Decrease tidal volume. D. Add sedative. Answer. A. Increase inspiratory flow rate. Rationale. Slow rise indicates flow starvation and dysynchrony. Increasing flow improves comfort without unnecessary sedation. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.